1. A 36-year-old diabetic patient presents with a plantar foot ulcer that probes to bone. As a clinical educator teaching residents, which step best models adult learning principles during bedside instruction? A. Demonstrate the wound assessment process and then coach residents through supervised practice. B. Deliver a lengthy lecture on diabetic foot pathophysiology without patient interaction. C. Require residents to read a textbook chapter and discuss at a later date. D. Show a pre-recorded video and end the session early. 2. During curriculum development for a podiatric residency module on forefoot biomechanics, which element most ensures alignment with competency-based evaluation? A. Writing measurable learning objectives tied to specific clinical tasks. B. Providing unlimited reading resources without outcomes. C. Scheduling sessions based only on faculty availability. D. Using general course titles without assessment mapping. 3. A patient with chronic plantar fasciitis asks about non-operative management. Which communication approach best supports shared decision-making? A. Explain options with benefits and risks, ask patient preferences, and agree on a trial plan. B. Recommend a single treatment without discussing alternatives. C. Give the patient a printed protocol and say to follow it strictly. D. Refer the patient to another specialist immediately. 4. When assessing a resident's clinical competence in nail surgery, which evaluation method most validly measures procedural skill? A. Direct observation with a standardized checklist during real procedures. B. A multiple-choice exam on nail anatomy. C. Counting number of surgeries performed without quality metrics. D. A self-reflection essay about confidence levels. 5. Which regulatory compliance activity is most important for maintaining a podiatry clinic's controlled substance privileges? A. Keeping secure, auditable logs of prescriptions and dispensing records. B. Relying on verbal reports from staff about inventory. C. Storing medication records in a shared personal notebook. D. Destroying old records after 1 week. 6. A mentor observes a junior clinician struggling with differential diagnosis for neuropathic foot pain. Which mentoring technique is most effective to develop critical thinking? A. Use guided questioning about history, exam findings, and diagnostic priorities. B. Provide the correct diagnosis immediately and move to the next case. C. Assign independent reading and delay feedback for weeks. D. Limit exposure to complex cases until competence increases. 7. In designing a continuing education workshop on diabetic foot infection, which instructional design principle most improves adult learner engagement? A. Incorporating case-based small group problem solving with immediate feedback. B. Delivering only didactic slides for the entire workshop. C. Focusing exclusively on historical perspectives without cases. D. Presenting content without opportunities for discussion. 8. Which radiographic finding on a weight-bearing foot X-ray best indicates a progressive Charcot neuroarthropathy stage requiring urgent offloading? A. Midfoot collapse with bony fragmentation and joint subluxation. B. Mild soft tissue swelling only without osseous change. C. A single non-displaced metatarsal stress fracture. D. Clear joint spaces without deformity. 9. When evaluating the effectiveness of a new residency teaching module, which outcome measure best reflects behavioral change in the clinic? A. Increase in appropriate offloading device prescriptions documented in patient charts. B. Number of hours residents logged in the module. C. Residents' self-rated satisfaction scores alone. D. Attendance rates at module sessions. 10. A patient requires post-operative opioid prescriptions. Which compliance practice ensures safe prescribing and legal adherence? A. Documenting pain assessment, treatment plan, quantity prescribed, and follow-up arrangements in the chart. B. Prescribing based on habitual amounts without documentation. C. Providing verbal instructions only with no written record. D. Allowing patients to self-determine refill intervals. 11. Which mentoring behavior best fosters a supportive learning environment for diverse trainees? A. Soliciting mentee goals, offering tailored feedback, and facilitating reflective practice. B. Applying the same feedback style to every mentee regardless of need. C. Publicly criticizing errors to encourage quick improvement. D. Withholding opportunities until mentees demonstrate perfection. 12. In diagnosing posterior tibial tendon dysfunction, which clinical test most reliably assesses tendon integrity? A. Single leg heel raise observing hindfoot inversion and arch restoration. B. Passive dorsiflexion of the toes only. C. Manual muscle testing of hip abductors. D. Ankle reflex testing alone. 13. A course director wants to reduce test bias on end-of-rotation exams. Which action most reduces construct-irrelevant variance? A. Use blueprinting to link questions to clearly defined competencies and ensure diverse item formats. B. Reuse a single faculty member's preferred question bank without review. C. Include ambiguous items that rely on cultural assumptions. D. Grade subjectively without rubric. 14. When teaching residents to communicate difficult prognoses, which communication skills should be modeled first? A. Delivering information with empathy, clear language, and checking for understanding. B. Using technical terminology to maintain professional distance. C. Minimizing time spent with the patient to remain objective. D. Delegating all communication to nursing staff. 15. For a wound care curriculum emphasizing evidence-based practice, which evaluation shows knowledge transfer most effectively? A. Clinical audit demonstrating improved wound healing rates after protocol adoption. B. A closed-book quiz 1 week after training. C. A checklist of materials distributed to staff. D. A satisfaction survey from participants. 16. Which clinical scenario suggests peripheral arterial disease as a contributing factor to a non-healing foot ulcer? A. Diminished dorsalis pedis and posterior tibial pulses with cool, shiny skin. B. Warm, well-perfused foot with brisk capillary refill. C. Localized cellulitis without vascular compromise signs. D. Intact hair growth and normal pedal pulses. 17. A residency program must comply with scope of practice regulations. Which administrative practice best ensures compliance? A. Maintaining clear job descriptions, privileging records, and documenting supervision levels for procedures. B. Allowing trainees to perform unsupervised procedures beyond their credentialing. C. Keeping privileging records informally on personal devices. D. Assigning procedures regardless of documented competency. 18. A mentor uses deliberate practice to improve a trainee's ultrasound-guided injection skills. Which element is essential for deliberate practice? A. Targeted repetition with immediate instructor feedback and increasing difficulty. B. Random practice without feedback until mastery occurs. C. Occasional practice sessions with no evaluation. Watching videos infrequently and practicing alone. 19. Which pharmacologic property of nonsteroidal anti-inflammatory medications is most relevant when counseling patients with chronic kidney disease? A. Potential for reduced renal perfusion and worsening renal function with prolonged use. B. Complete renal excretion without systemic effects. C. No interaction with renal blood flow. D. Universal safety in renal impairment. 20. When integrating cultural competence into a podiatry curriculum, which teaching method best promotes learner reflection and application? A. Structured reflective journals combined with simulated patient encounters from diverse backgrounds. B. One-time lecture on culture without applied practice. C. Recommending optional reading with no assessment. D. Avoiding discussion of cultural contexts to maintain neutrality. 21. In assessing hallux limitus, which physical exam finding is most indicative of early degenerative joint disease? A. Limitation of dorsiflexion at the first metatarsophalangeal joint during gait with pain on push-off. B. Full painless range of motion at the first metatarsophalangeal joint. C. Isolated toe numbness without motion limitation. D. Pain isolated to the lateral ankle. 22. A program director wants to evaluate whether their communication training reduces patient complaints. Which metric best demonstrates improvement? A. Reduction in validated patient-reported communication dissatisfaction scores over 6 months. B. Number of training sessions held regardless of outcomes. C. Faculty opinion that communication improved. D. Increase in clinic throughput without patient input. 23. Which preoperative factor most increases risk for postoperative wound complications in diabetic foot surgery? A. Poor glycemic control as evidenced by elevated hemoglobin A1C. B. Younger chronological age without comorbidities. C. Short surgical duration and minimal tissue handling. D. Optimal nutritional status and good glycemic control. 24. When teaching clinical reasoning, which instructional strategy most effectively develops diagnostic schemas? A. Comparing multiple patient cases that highlight distinguishing features and pitfalls. B. Presenting a single prototypical case repeatedly. Emphasizing rote memorization of diagnoses lists. D. Avoiding comparative analysis to minimize confusion. 25. In maintaining medical records for audit readiness, which practice best meets legal and regulatory standards? A. Accurate, timely documentation with secure access controls and retention per regulations. B. Storing records on unsecured personal devices for convenience. C. Backdating entries to fit audit narratives. D. Destroying records before required retention periods. 26. A trainee demonstrates difficulty obtaining an adequate history from non-English speaking patients. Which communication skill training is most effective? A. Role-play scenarios using certified interpreter services and teach-back verification. B. Relying on family members to translate without checking accuracy. C. Proceeding with clinical workup without history. D. Using automated translation apps without verification.